Ashley with Medical Oncology.
And I'm Tina with Radiation Oncology.
And
we're here to talk about head and neck cancer.
Head and neck cancer is cancer of the mouth, nose, salivary glands, or other areas of the head and neck. Symptoms may include a non-healing sore, difficulty swallowing, a neck mass, or change in voice.
Risk factors include alcohol use, tobacco use, infections such as HPV or mono, poor dental hygiene, and environmental inhalants. It is usually diagnosed with a scan followed by a biopsy.
What happens after the biopsy?
The patient may have surgery and/or may be referred to a radiation oncologist. The radiation oncology department does staging of the cancer, in which they may do a PET scan or a CT scan. If the origin of the disease is unknown, these scans will help determine the origin.
Do all patients get radiation?
Not all patients get radiation. It depends on the size of the tumor, as well as whether there's lymph node involvement and whether the tumor was fully removed, or whether there's a close surgical margin to the cancer. If the surgery removal of the tumor is complete and there's a low likelihood of spread to the patient, then the patient may not need any further treatment.
Let's say the patient does get treatment. What are the side effects of radiation?
Side effects of radiation include fatigue, skin reactions, or possible hair loss within the treatment field, depending on the dose and site. The patient may also have dry mouth, sores in the mouth or throat, speech changes, painful or difficulty swallowing, taste changes, neck tightness, ear or jaw pain, thyroid changes, or possibly swelling of the lymph nodes in the underside of the neck, in which people refer to as the turkey gobble. They may also have difficulty opening their jaw to eat.
Can I prevent these side effects?
Yes. Before treatment, you should see your dentist to have good dental exam and mouth cleaning. In addition, you should get non-alcohol mouthwashes such as ACT or Biotine for daily use. Furthermore, xylitol lozenges or gum may help to moisten the mouth to relieve dry mouth. Thrush or mouth sores can be prevented with normal saline rinses. It is made by mixing 2 cups of water, 1 teaspoon of baking soda, and 1 teaspoon of salt. You want to rinse your mouth frequently. You should make a new solution daily. If you are a smoker, you should stop smoking before treatments start.
How long do these side effects last?
The side effects usually occur approximately the 4th week of treatment. Many of the side effects can last up to 3 months to 6 months. However, dry mouth and taste changes may last longer.
I heard you say the side effects are usually worse at week 4. Can you tell me more about what the treatment is like? How many weeks do patients have treatments?
Radiation is typically given daily for 5 to 7.5 weeks, Monday through Friday, no weekends, no holidays. You are on a hard table and you have a mask that is bolted to the table. Treatment lasts for 3 to 5 minutes.
Are the treatments painful?
No, it's just like getting an x-ray.
So 3 to 5 minutes daily for about 5 to 7.5 weeks?
Yes.
Are patients able to drive home afterwards?
Yes. Toward the end of treatment, though, patients may get fatigued and choose to have a driver.
This is a daily treatment. Does the patient see you every day?
In radiation oncology, the provider sees the patient usually once a week during the treatment course. The radiation therapist does see the patient daily. If during treatment you have any questions or concerns, please ask to speak to your radiation oncology provider.
What is follow-up like after the radiation is done?
A patient will follow up 2 to 4 weeks after their last dose, depending on how they tolerated treatment. At 3 months, we will do a PET scan to see if we cured their cancer.
Earlier, I heard you say that patients may need to see a dentist. Are there other specialists that they should see?
You may need to see physical therapy or get a massage to decrease the swelling in your neck. If you have difficulty with speech or swallowing after surgery, then you might meet with a speech therapist. I recommend all head and neck patients meet with a dietitian. You may or not be recommended to get a feeding tube based on the type of head and neck cancer. This should be discussed with your radiation oncologist, and they may need to see a medical oncologist. Ashley, can you tell us more about the medical oncology side?
I'd love to. We're going to talk about types of chemo with head and neck cancer patients in part 2. Before we go, do you have any final messages that you'd like to share?
To get successful results and get to the best chance of cure from cancer, a patient should have meticulous oral care with normal saline rinses. They need to maintain their nutrition and their hydration and avoid weight loss. Smoking and alcohol use should be avoided. Any delay in treatment or skipping of treatments decreases the chance of overall survival. So my goal is to keep the patient out of the hospital and to keep the treatment schedule.
Thank you, Tina. In summary, head and neck cancer can be very overwhelming, but taking one step at a time and keeping in communication with your providers can help you get through this rough time. Here at Ironwood Cancer and Research Centers, we work as a team to get you through this. You are not alone. Join us next week for part 2 of head and neck cancer treatments.
If you missed our Lunch and Learn Live, the link is below in the description.